Hey guys, it's Jeanette. So apparently my camera hasn't been in shape. It overheated, and I really just want to kind of share with you guys how I take my notes. I'm using my 5-star Flex notebook that I've had since the first semester of nursing school, and I'm just going to sit here and read down my notes, and this is how I would head a study group. So hopefully you get something out of it, and I'll try to just interject some things that how the teacher taught it, and how I took my notes, and then how do I test myself to make sure that I know exactly, or at least that I have learned the content. So this particular lecture is acute intracranial problems. And this is the format of it. This is something new that I've started. It's printing 3 PowerPoint slides on a landscape page, and then it comes off with these little lines. And I'm sorry, my handwriting is really bad. I would share more, but you won't be able to read it. And that's probably why I type 75 words per minute, because I suck at writing. So hopefully you get something out of it. I'm just trying to kind of help you guys walk you through at least how I take my notes and how I study, how I quiz my peers, and then go from there. All right, so in class, I'm taking my notes, highlighter, purple pen, sometimes a sticky note, and I make notes on anything that nurse management, what nurse really needs to know, nurse needs to do, any big like neon sign symptoms that will make me recall the actual disease process, as well as any extra tables or pages that the instructor has informed me to take a look at prior to the exam. So let's just start off. So in my notes, the first thing I have is no ICP questions. Okay, it makes sense. I need to learn the intracranial pressure questions. What are those? And then first is the normal range for intracranial pressure. And in here, I have 0 to 20 millimeters of mercury. So in my mind, I'm like, okay, what is the normal range for ICP? 20 to 0 to 20. And then, so when I'm asking, they can respond, and if they don't, then I look down and I tell them. So it's almost like 3 times trying to learn something, which is great for everyone. I like to say it and like to hear it. So yeah, I'm like, okay, good. So the normal ICP is 0 to 20 millimeters of mercury. Great. Then I need to know the anatomy in terms of skin, scalp, the dura, where the injury is, and that will tell me what I would need to do as a nurse. So then I go down and we start talking about the anatomy of the brain, the head. So it says, what is the brain made of? Okay, it says it's 1.5 kilograms. Okay, do you know the weight? 1.5. Great. What are the 3 components of the brain? You know, blood, tissue, and CSF. Okay, great. What degree of elevated head of bed should the patient be at if they have increased intracranial pressure? And then either they would answer or they won't. And I'll say, okay, 30 to 45. So then they'll be like, okay, is it 30 to 45? Yes. So it's kind of like we're trying to say it as much as possible. Next thing, I say, know what concussions, contusions, and DAIs are. So this may be when the instructor was going down their thought process and like, okay, well, you need to know these 3 things, and I made a note of them. And later down the lecture, they would actually go into them further. So the next thing is, for example, the PowerPoint slide says epidural, subdural, and intracerebral hematomas. So the instructor was like, so there are 3 types of hematomas. Then he listed them. Then I went ahead, 3 types of hematomas, 1, 2, and 3. And then he was like, if a patient has an epidural hematoma, that's an emergency craniotomy to drain it out, because there are so many arteries there that the blood will leak out faster. So I went parentheses, emergency craniotomy, the worst one, and that really helps me to know, to suspect or expect a question that's going to challenge my knowledge on, okay, do you know the different types of hematomas? I'm like, okay, I know the 3, and which one's the worst? Epidural, he told me, because there's arteries in that layer that they can bleed out faster. Therefore, you have to get them into surgery to drain it out. So that's how I've kind of, I've heard, I've read, and I've tested myself, and then I test my peers. And I'll just keep going. Maybe this is interesting to you. I'm not too sure. Okay, so this right here is kind of tricky depending on how you learn. And it's when it comes, okay, so this one is where am I? The body produces X amount of milliliters of fluid, and you have to make sure that you're learning the numbers to the right fluid. So this one specifically is regarding the cerebrospinal fluid, the CSF, and it says CSF is constantly secreted 20 to 30 milliliters per hour, circulated, absorbed at an equal rate. So my question would be, okay, so what's the normal rate that our body produces CSF? They would tell me the answer. I'm like, okay, great. Then a few lines after, it says if there is more than 150 milliliters of CSF in the brain, it is termed hydrocephalus. So then I would go, okay, so now that we know the normal range, and they would repeat it, what if it's greater than this, 150? What do we call that? Hydrocephalus. So we try to just always go down the process of things, and I go in a very linear format. I go like just page by page because everything kind of builds on the previous slide. So then we go on to the next and says normal cerebral blood flow. So this is a whole new different, I don't want to say calculation, but it is a different calculation. The CBF is 50 milliliters per minute per 100 grams. So then I would say, okay, so what was the CSF? And they would say the correct number. If not, I would read and make sure that we all understand the correct number. And then next, I'm like, okay, so now we're talking about CBF. What or how do you calculate that? And then it would tell me 15 milliliters per minute per 100 grams. And then at that point, we would probably pause and then say, okay, say the brain weighed 2 kilograms or anything, just so we can actually work through the math at that point, and then we would all be on the same page or not. And that's when we'll stop, like, okay, so what did you do? And we kind of help each other there. For things like that, or anything that says refer to this table, try to do it in that moment so you'll remember reading the notes and like, okay, yeah, I needed to look into the book, and that's when I read this specific intervention. So, and I started doing this, I don't know if you can tell. Oh, where is it? It's a hot mess. These little eyeballs. So I just put like little eyeballs, and it's helping me visualize when I look down at my notes, what assessment, what should I really pay attention to in a patient. And this one specifically is if the patient's not getting enough of the CBF, what would I look for in a patient? And I had little eyeball. Patient will probably be confused because they're not getting enough blood nor oxygenation. Therefore, they will have an altered level of consciousness, and that would be something I would pay special attention to. That would help me understand whether they are getting enough or not. Hopefully that makes sense. Okay, next. CPP equals MAP minus ICP. So, again, I have this little cloud thing, and I have the formula, and then we would stop. I'm like, okay, so do you know what CPP is? Do you know what the MAP is? Do you know what ICP is? And then we'll do a math problem at that moment just to make sure that we are all on the same page. And I'm not sure if you guys know, but for us, we have at least 4 dosage calculation problems per exam. Okay, so my teacher is reading, and he's like, you know what, I just want you to know that if the MAP goes up, your CPP goes up. I'm like, okay, and if your ICP goes, up, then your, if your ICP goes down, then your CPP goes up. So I'm like, what is he talking about? So we have to literally take a moment. Okay, guys, did you remember what he said about the CPP? So I just realized that some of you guys may not know. So that's a cerebral perfusion pressure. And then CPP is the pressure needed to ensure blood flow to the brain. So the formula is CPP equals MAP minus ICP. And then here, I don't know if you can tell, but again, I have a normal range. So it says normal CPP is 60 to 100. So then again, I would be like, hey, how do you know the normal range? What is it? And then we'll do another math problem. And then I'm trying to find something else that I can explain how I process. Okay, so this right here, it's a slide and it's termed factors affecting the cerebral blood flow. And he's like, many different things can affect that. Okay, so we have cardiac arrest. And I'll say, do you know why cardiac arrest affects the cerebral blood flow? Yes or no, and they answer or not. And then in my notes, I'll look and it says, because if you have cardiac arrest, your heart's not pumping, therefore you have decreased cardiac output. And if you have decreased cardiac output, it's not going anywhere. You're not going to get enough blood and oxygen where it needs to go. So that's why your CBF would go down if you're in cardiac arrest. Everybody got that? Cool. And then we go on with respiratory arrest. Same deal. You're not going to get enough oxygen to the brain. And then you got that? Great. And then we have hemorrhage, infection, and then the whole like PaCO2 and all that stuff. So it's funny because for me, I like to lead and I like to talk through stuff. And I think it's because I hear it and then I've studied before my study sessions. It really helps me to kind of like remember what I'm reading, and it helps to say it more confidently. And if I say it, I can hear it. I don't know. Okay, let's see what else. So I really actually like this one. Okay. So for example, this one is regarding monitoring ICP. So the teacher was like, so who should monitor ICP? Is it a med-surg nurse? And then he'll probably be like, no, it has to be an experienced neuro nurse. So most likely an ICU nurse needs to be monitoring a patient that has ICP problem. So right there, it's like, I've done enough practice questions and I'm pretty sure you're telling me that I need to make sure that I know assignments. Like let's say a charge nurse is assigning a floating nurse. Which patient should she have? Obviously, I'm not going to give her a patient that has increased intracranial pressure, which requires so much other assessment, skilled assessment, that this probably OB nurse has never done in her life. So I made a note of that. So know how to assign appropriate patients to, nurses in their school level. All right, so, okay, for example, we're talking about the Glasgow Coma Scale. So he was like, you have to know, 15 is normal, it's good. 8, below 8, you want to monitor their ICP. And I was like, okay, 15, normal. And you can be shorthand. Less than 8, monitor ICP. Less than 3, coma. Bad, 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 exclamation point, exclamation point. And that would just help me at least know the ranges. And even if I didn't know what that scale looked like, or I just couldn't even remember how to add all that, I would at least know 3 big important facts. 15, normal, great. When I hear Glasgow 15, okay, good. 8, okay. Now I know if it's less than 8, I have to monitor for ICP changes. Okay. And then if it's less than 3, then I know it's bad. So that gives me kind of landmarks, especially with tools that I don't really use all the time. And I haven't had to. Okay, another example. So he'll start talking and say, okay, when someone has fluid overload, what do you normally give them? A diuretic. Okay, yeah, great. But when someone has increased intracranial pressure, what type of diuretic would you need to give them? And I was like, it was one of those things where I'm like, mannitol? I don't want to say it out loud because I don't want to be wrong. And so someone beat me to it and they're like, mannitol. And I was like, yes, I got it right. But I still had anxiety to answer. But as soon as she said it, I was like, start, mannitol for increased intracranial pressure. And so I know that a question was going to test my knowledge of a patient that has increased ICP, that the only diuretic that would work for them is mannitol. So I would make sure I know to pull mannitol if needed. Okay, this is exciting. I haven't done a video like this. Okay, sorry guys. Let's see. Ugh, this stupid question. Okay, I'm not even gonna go there. Am I gonna go there? Okay, let's go there. So, how do you know if a patient has increased intracranial pressure? So then they have this really, let me show you the picture. That guy right there, that eye. Ow, 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 ow. Okay. So it says star, assess pupil dilation. So now I know, someone has increased intracranial pressure. The first thing I'm going to look at are their pupils. Okay. And then dilation, very dangerous. So apparently somehow during the lecture, when he talked about this, it's like really, really bad. Eyes bulging is a medical emergency. And then again, I have a note regarding the Glasgow Coma Scale. And then I have a note that the pupil dilation could occur on the affected side, or one side, and then if the intracranial pressure continues to increase, then it will show on the other side. So bilateral pupil dilation. So, and then he's like, this is also known as sunset eye. And so I kind of do this silly eye thing. That's supposed to be an eye, I know. It's pretty bad. And I highlighted sunset eye, increasing intracranial pressure. First one eye, then the other. And those are shorthand notes. And I'm like, okay, I at least know the thought process behind it. And then I would go, the next slide is causes for ICP. Increased intracranial pressure, sorry. Then I have 4. And I'm like, okay, guys, there are 4 big reasons that could cause a patient to have increased intracranial pressure. All right, we have hemorrhage, tumor, edema, increase in CSF, or an aneurysm has ruptured. And we would just make sure that, you know, we're able to say that, so we know if there is a case scenario, if any of those 4 are in the stem, then we know that you know, it is a increased intracranial pressure type of problem, patient, and then we have to kind of turn our thinking on what we do for that type of patient. So I guess that's it. I'll stop because it's about 17 minutes, and I don't even know if you guys will like this video. I am so sorry. But yes, that is my strategy. This is how I organize my notes. I like the 3 on one side, space to write. I've been using the same 5-star notebook. I actually haven't been using my textbook in class because it's so big, but I do write the pages that I have to read before. And I really try to study, at least read my notes every single day. And then we really hit it hard, like 8 hours a day, maybe 5 days before the exam, to really give enough time to go through all the notes a couple of times and do as many practice questions. And I think we've been averaging a little over 200 before each exam. So that's it. Hopefully you guys got something out of it. Let me know if you like this video or if it was just a waste of time. I'm so sorry. But I just wanted to share with you guys how I study and how I talk to my peers and study partners. And I guess that's it. I guess that is it. I don't know why I just slurred that. Anyways, don't forget to comment, like, and subscribe, and share the videos. Bye.